reducing risk of stillbirth. Powered by Discover Parenting. Take all your antenatal appointments. It's important not to miss any of your antenatal appointments. Some of the tests and measurements that can identify potential problems have to be done at specific times. Going to all your appointments will also mean your midwife can give you relevant information as your pregnancy progresses. Eat healthily and keep active. Try to swap unhealthy foods for healthier options, and try to keep active. Being overweight or obese can increase the risk of problems in pregnancy. Pregnancy is not the time for a weight loss diet, but you do not need to put on any extra kilos in pregnancy if you're already overweight. Stop smoking. If you smoke, the best thing you can do is to stop. Stopping at any time in pregnancy will help, though the sooner the better. Passive smoking, breathing in smoke from other people's cigarettes, is also harmful in pregnancy, so avoid being around people who are smoking if you can. Avoid alcohol in pregnancy. The safest way to ensure your baby is not damaged by alcohol is not to drink while you're pregnant. If you're finding it hard to stop drinking, ask for help from your midwife or GP. Sleep on your side. Research suggests that going to sleep on your back after 28 weeks of pregnancy doubles the risk of stillbirth. It's thought this may be to do with the flow of blood and oxygen to the baby. The safest option is to fall asleep on your side, either left or right. Do not worry if you wake up on your back, just turn onto your side to go back to sleep. Drug usage. If you use or have used street drugs, such as cannabis, cocaine, ecstasy, or heroin, or other substances, tell your midwife. Do not be afraid to share this information. It'll be treated in confidence and only shared with other relevant professionals if the midwife thinks it's in the best interests of you and your baby. Seasonal flu vaccination. Pregnant women are more at risk from flu complications, such as bronchitis and pneumonia, than the general population. These complications can harm your baby. Women who have had the vaccine in pregnancy also pass some protection on to their babies, which lasts for the first few months of the baby's life. Other precautions. 1. Avoid people who are ill. If you have been or are in contact with someone with an infection, speak to your midwife or GP for advice. 2. Wash your hands before preparing and eating food, after toilet, dealing with other children to make sure your hygiene. 3. Prepare and store food safely in order to avoid risk of infections. 4. Avoid some foods in pregnancy such as raw or undercooked meat, some cheeses, and unpasteurized milk. When to get help. 1. Your baby's movements have reduced or changed. 2. You have bleeding from your vagina. 3. You have unusual vaginal discharge. 4. You have swelling, blurred vision, or severe headache. 5. You have itching anywhere on your body, possibly worse at night. Thanks for watching. Like, share and subscribe.